The PICO question that I decided to research on is, does HbA1c testing make diabetes patients exhibit better management of blood glucose levels than self-testing at home? The reason that I chose this question is that diabetes is one of the most common diagnoses that is present in the United States. It can be really easy to have excessively high glucose levels. So to get some background on HbA1c testing, A1c is a blood pigment that binds to glucose. So HbA1c is indicative of how much glucose is present in your blood. The HbA1c level reflects how well a diabetes mellitus patient manages their blood sugar. So when you test HbA1c, the results that you're getting is reflecting how well they've been managing their blood sugar for the past 6 to 8 weeks. It doesn't show how well they've been managing their blood sugar that day. So when you do HbA1c testing, you are able to take a sample at any time on any day, and it's going to give you accurate results on their blood sugar management for 6 to 8 weeks. It's measured in the hospital lab, so this is one of the ways that doctors will monitor how well a patient is doing with their blood sugar. HbA1c that is giving you a result of 6.5% of the total hemoglobin is indicative of diabetes and can be used for diagnosing. The goal level for patients that have diabetes is less than 7% because it is so difficult for them to keep their blood sugar at a safe level. So the reasonable goal is less than 7%. The purpose of my PICO question was to determine if diabetes mellitus patients can experience better control of their diabetes using the HbA1c testing rather than their at-home testing. So for doing my research, I used the keywords self, monitor, glucose, diabetes, HbA1c, and compare. And the search engines I used were Google Scholar, PubMed, CINAHL, and Academic OneFile. PubMed, CINAHL, and Academic OneFile are the most recommended search engines for my program, Clinical Laboratory Sciences, and then Google Scholar was also recommended to me by another student in our class. My results were varying severely with the diabetes topic. There were results on monitoring gestational diabetes, pediatric monitoring. There were articles that were different methods of self-monitoring. There was also one that was about improving the metabolic control, diagnosing, and then the two that I used were one that was about comparing the different methods of insulin delivery to see which one worked better to lower HbA1c. And then the other article I used was discussing the benefits of point-of-care testing for HbA1c, which would be rapid test results at your doctor's office. So the titles of these were, the first one was Continuous Glucose Monitoring Reduces HbA1c More Than Self-Monitoring in Type 1 Diabetes. And I picked this one because it discussed how best to lower a patient's HbA1c. So I thought that was about as relevant as I was going to get to my actual PICO question. The other one was called The Continuing Case for Point-of-Care Testing for HbA1c, and I picked that just because it talked about the benefits of HbA1c testing, so I thought it would be a good way to look at how HbA1c is affecting diabetic patients. So for the first article, the glucose monitoring, it was a quantitative study. There was a significant amount of data. There was a chart that showed how patients' HbA1c was lowered by their different self-monitoring methods. The way it worked was it compared the two methods that were covered. They used clinical trials, and basically they took a whole bunch of studies that had already been done, and they studied them more in detail and compared them to see how the results interacted with each other and how they were related. The population included all diabetic patients that were in any age group, race, or gender. There was no specific set of patients that were examined, mostly because it was just a lot of studies that were compiled together. So there were a couple of exclusions that I found. They excluded the studies that only discussed adolescents. I think that was in order to prevent the data from being swayed in a particular direction based on a large group of one diabetic population. And it also excluded patients that only used a particular self-monitoring method for less than 24 hours. Second article about point-of-care testing for HbA1c included both quantitative and qualitative data, but most of it was qualitative. It was just a lot of discussion about HbA1c testing and how beneficial it is. They compared the HbA1c testing that a hospital lab will do that might take a couple days to get results on with the new point-of-care HbA1c analyzers that can give you rapid results within your doctor's appointment that you have. It said that the population included 5,700 patients with diabetes, but there were no specifics on selecting a particular group of patients. The findings that I came up with for the first study about continuous glucose monitoring versus the self-monitoring. Continuous glucose monitoring lowered HbA1c levels more effectively. The second study about point-of-care testing, what I found is that it allows for immediate results of HbA1c testing. So patients are experiencing a more convenient doctor's appointment. They aren't having to wait for days for their results. They're finding out right away that they need to adjust their blood glucose habits, whether it be what they're eating or what they're drinking. As far as ethical considerations, I determined that ethics were complied with very well for each study. There were no names given, there weren't even specific ages or races or genders or anything like that. So none of the specific data results were included for any patient. So ethically they were fine, they weren't oversharing any information. As far as the strength, quality, and credibility go, for the first study, I determined that it was very weak as far as strength is concerned. There was limited information offered, and it was an unspecified population. And the article itself was so short that it didn't give enough information. As far as quality, I determined that it was an average quality study because it did give numerical data, it did give a chart that was good for visual purposes, but it still didn't have that large amount of information that a person would want when they're trying to examine a study. Credibility was good though. The journal that the article was published by was created by the American College of Physicians, so they definitely have a good reputation for their knowledge and abilities. They just didn't have enough information available. The strength, quality, and credibility of the second article. For strength, I decided it was an average strength article. It seemed like it was very biased towards having point of care HbA1c testing be the better option. It may very well be the better option, but it was written by the man who is in charge of point of care analyzers at his program, so it would make sense that he would be biased towards his analyzer. There was also very little quantitative data, and I feel like for this particular item that's really necessary because we want to know about the accuracy. We want to make sure that people are getting good results because this is their health that we're concerned with. As far as quality, I also said average. It was really well put together, but there overall just isn't enough information about other methods of testing as to compare the two and really make a good decision on which method is best. Like I said, his credibility is really strong. He has a degree in forensic and biomedical sciences. He's the product manager of the program that specializes in these point of care analyzers at his company, so he definitely has the ability to be writing on this topic. So credibility was strong. As far as contribution to the evidence-based practices in healthcare, I determined that neither one of these really has significant contribution. The first study does help to encourage the continuous glucose monitoring devices over self-monitoring devices, so I guess we can count that as a contribution. But overall, I didn't feel like there was enough evidence in either of these studies to really be a valuable contribution. For relevance, the first study was relevant because it was showing the benefits of continuous glucose monitoring on lowering HbA1c, which is really what the whole purpose of this is that we want patients to have a lower HbA1c. We want them to be healthier, and we want them to have a lot of success when they're monitoring their glucose. It had good information for diabetic patients. It had good information for healthcare providers as far as advising patients on what best way there is to monitor their glucose. As far as the PICO question, though, there was very little relevance. It wasn't going to answer my question. The second study had good information about the point of care HbA1c testing, so it was relevant to the overall topic of HbA1c. Very little relevance to my PICO question, once again, but it is valuable information for healthcare providers and for myself, honestly, when I get into my field and I'm performing these kinds of tests. It's nice to know what analyzers are best for every test and what the best way is to get valuable and accurate test results to patients to help them with their conditions. So in conclusion, I was not able to answer my PICO question with the studies that I was finding online, but I did have a valuable experience going through these articles and learning more about the evidence-based practices. HbA1c is an important test for any patient that has diabetes mellitus, whether it's type 1 or type 2. And I do believe that this testing of HbA1c is going to continue to be really valuable for diagnosing diabetes as well as monitoring diabetes. And I believe that any of us, since we are all going into the medical field, any of us can use this information valuably just because of how prevalent diabetes is.